everyone, it's Chris from You From Home. I'm so excited to be here with my friend, Cambria DeMarco Perry. She's an amazing talent. Cambria, thanks so much for being here with us today.
Thanks for having me on.
Yeah, I need to read some of your accolades, Cambria, so people know how talented you are and how lucky they are to hear from you today before we get into it. So Cambria has over 25 years in traditional medicine, including a master's from Columbia in nursing. She's a nurse practitioner. She's a board certified person in acute care. She has over 18 years in the emergency rooms at Columbia, Cedars-Sinai, UCLA, and Rady Children's in San Diego. She's done functional medicine for nearly a decade, and we'll tell you what functional medicine is if you don't know what that is in just a little bit. She's worked with Alzheimer's patients, and in many cases, in all cases, she's worked with actually reversed the course on where Alzheimer's was going for them, which is incredibly exciting. And also worked with special needs kiddos and had incredible results with her own kids. I'm excited to hear that, having two kids of my own that are also on the spectrum. She loves in her free time, I don't know how you have any free time, Cambria, to her Arabian horses are a great love of hers. So Cambria, welcome. So glad to have you and honored to have you chat with us today.
Wonderful to be with you.
Yeah. So let's just get started. Functional medicine, for those of us who have no clue what that means, can you walk us through what that is and how it's different than, you know, just going to your normal provider and getting medications? What is functional medicine?
Yeah, so functional medicine has been around for about the last 15, 20 years, but it's really come into favor probably over the last 5 to 10 years. They have an entire wing at the Cleveland Clinic, so it is very, very, very science-based, and it's looking at different biomarkers. It's looking to optimize health rather than treating chronic disease. So in functional medicine, we are looking at what the body needs to function optimally, if there's things that are in the way, how we remove those things, and then give the body basically what it needs to thrive. The principles of functional medicine are that we look at the body more in terms of functional systems. So like we look at the communication system, which has to do with hormones and neurotransmitters. We'll look at assimilation, which is digestion. So rather than looking at the body, like if you have a kidney disease, you go to a nephrologist, we are looking at the systems of the body and trying to get all of the systems working in harmony so that the whole entire unit can thrive.
Nice. So are some of those things like, I've seen some stuff on like microbiome, and are those part of it? Okay.
Yeah, so the microbiome would be part of like the digestion and assimilation. It's also part of the immune system. So that the beauty about functional medicine is basically if you are looking at the body as a system, as a unit, the brain is not separate from the gut, is not separate from the blood. So when you look at the microbiome or the gut health, that is going to affect the brain because you're looking at blood-brain barrier issues. So if you have a leaky gut, you're going to have a leaky brain. It also affects the immune system. It also affects nutrient absorption. So we absolutely look at that. And then the magic of it is that no matter what's wrong, whether it's digestion, hormones, inflammation, when we correct that, no matter what the issue is, the issue tends to get better.
Nice. And just give us a sense, let's make up a client, of course, no one real, but what do those protocols look like? Are they diet? Are they supplements? Are they exercise? How do you affect change?
So it's the ultimate in personalized medicine. So basically when you come into me, people will get like a 20-page intake form that details their history, but also their family history, their nutrition, their sleep, their relationships, their stressors. So we look at the center of the functional medicine matrix is sort of the mind, body, spirit. So that's sort of in the center. And then around that are all the different systems, communication, immune, digestion. We look at all that in terms of biomarkers. And then we also look at things called antecedents, triggers, and mediators. So we'll look at things that may have triggered or be perpetuating a certain disease. And then we look at lifestyle factors. So, I mean, we look at really everything that could affect that person. And that's why it's so different than traditional medicine, because we are looking at really a holistic model, and then not only looking at biochemistry, but looking if somebody has a lot of stress in their life and their relationships, well, what can we do to mitigate that? So we're looking at everything, and then we put together a plan that may involve diet, it may involve sleep, it may involve certain nutrients. At times it involves medication, like if somebody has dysbiosis or a parasite or an infection in their gut, it will involve potentially traditional medications. So we're not throwing out any of our tools or our knowledge, we're just bringing more to the table. And then when you look at somebody as a whole entire picture, then you're able to really mitigate change. And we don't have to see people as often, because we're not just sticking a Band-Aid on it. We're really partnering with patients for a future, vitality and improvement in their health and whatever their concerns are.
That's amazing. And it sounds like too, it's very results-based versus office visits based, right? You're really going after the result for your, I don't know if you call them patients or clients, but for the people you serve, right?
Yeah, absolutely. And what's fascinating about it is we do track a lot of lab values, but we also have questionnaires that we have, symptom questionnaires that we'll give in the initial part of the intake, and then we'll give them again 6 to 8 months later. And then you can actually see on our graphics the improvement in the patient. So like if somebody has a lot of imbalances in their immune system or their communication system, they'll basically light up in red initially. And then when we reassess 6 to 8 months later, that red area will have shrunk. And time and time again with the lab values, I mean, we have concrete data that we're able to show that this is where we started. We implement the intervention, and then we have concrete lab values that change for the better.
Wow, that's amazing, and so needed in healthcare, as you well know, right? The whole traditional model is broken for everyone.
It is, unfortunately.
And it just sounds amazing. So you talked a little bit before, we were talking briefly about a new protocol called the Walsh Protocol. Can you tell us a little bit more about that?
So the Walsh Protocol is been a huge contributor to my practice and to the success of my my clients. It is an additional protocol. Dr. William Walsh, he wrote a book called Nutrient Power, and he's a PhD biochemistry person, and he's studied for the last 60 years the biochemistry of mood. And what I'm finding is that when I implement his protocol, basically to all of my patients, they have improved. It's like icing on the cake for functional medicine. So even when I implement it for my dementia patients, they have increased benefit from the overlay of Walsh Protocol than just Dr. Bredesen's protocol alone. Wow. So Dr. Walsh, yes, it's monumental in terms of how it's changed my my practice. So he looks at key lab values: zinc, copper, homocysteine, whole blood histamine, and then something called urine pyrroles. I don't really ever do Walsh Protocol in isolation, because I think that there's a lot of things that you'd miss if you only did Walsh Protocol. But it's an absolute essential with anybody who has any mood issues or cognitive issues. So the zinc copper balance is really important in terms of people with anxiety or people with depression. So copper is very stimulating and agitating, and a lot of times kids who are on the spectrum, they will have some things that people could call OCD or repetitive behaviors, and that can actually be copper toxicity. Wow. So, and they can have insomnia. A lot of our kids have insomnia. So that a lot of times that can be corrected by correcting the zinc copper balance. It's monumental. And then the whole blood histamine is another one that is never checked on traditional labs, and that's part of Walsh Protocol. And what's so fascinating is that most of our antidepressants are actually antihistamines.
Wow.
So nobody checks whole blood histamine. But here we are in traditional medicine prescribing for depression over and over again, essentially antihistamines. So when you look at whole blood histamine, and I've had multiple patients, especially patients with postpartum depression, who come in with crazy zinc copper imbalances and then super high histamines. Histamine is very inflammatory. It's bad for the brain. And it causes a lot of anxiety and agitation. So, and it causes insomnia. So when you reduce histamine by actually breaking it down metabolically, usually we use things like SAMe, which is basically an amino acid. We use vitamin C, sometimes quercetin, different things that actually allow the body to correct that imbalance rather than blocking it with a prescription antihistamine. Then you no longer are perpetuating the cycle. So you're actually putting the body back in balance and allowing it to make the neurotransmitters properly, rather than, just adding a medication. And not that all medications are bad, and some people still need antidepressants, and that's absolutely fine. Right. But my sort of approach is to look at what the biochemistry is, correct the biochemistry, and then if we need to add additional things, that's fine. But at least do the body, the service of allowing it to correct the biochemistry and reach homeostasis before we start adding other synthetic things that may, in fact, give us more side effects, lead us further off balance. Totally.
Well, it's so poignant for me with kiddos on autism, because I've learned a lot of stuff now, and you're of course a medical professional, but you can feel really helpless, right? Because
absolutely,
the blowups are happening. There's a lot of, it's just crazy. And you hear people here, do this diet, do this routine, try this med. Some really well-intentioned people put stuff out there that aren't evidence-based.
Right.
Right. And it's nice to hear that there's this nice anchoring approach that at least is going to give the kiddo a shot. And I'm so excited to hear it, because it's very similar to the mental health neuroscience stuff that I do. That's, if kids aren't doing well, something's in their way. It's a skill issue. It's not intent. Exactly. And it sounds like it's the same on the physical medical side. It's something in their body is not putting them in a stable state.
Yeah.
And this gives them a shot, which is amazing.
Yeah. Yeah. And a lot of times I get sent people from psychiatrists, from psychologists, from all different specialties. When they're not getting better with traditional medicine, then they send them to me to see if the therapy is not working, there's probably something chemical going on. There's probably some kind of roadblock that you're not going to be able to get past unless you correct the biochemistry first. Yeah. And Dr. Walsh's protocol has implications not just for our kiddos, but epigenetically for moms who are wanting to conceive. So if there is a history of depression, anxiety, OCD, autism in the family, or if a mom has one kiddo with autism, it makes sense to do functional medicine and the Walsh protocol on the mom, because Dr. Walsh believes that the in utero environment that our kiddos, the soup in which they're grown, can stamp their genes and stamp their biochemistry for a certain setup. And it's not that setup can't be corrected, but if you correct the in utero environment, so if you are giving the kiddo, the growing little life, the optimal soup to grow in, you're going to have less of these genes, less of these apparent biochemical pathways that are then, stamped for the next generation. And I've seen that with my own two kiddos. Is I have one 24-year-old who was severely autistic, and he's doing well now, but he's 24, and he to this day still has an IEP. And then I have another kiddo that I brought into the world who's 7. And my sort of functional medicine journey was way less evolved 24 years ago. And I'm sure my in utero soup was not as ideal back then.
Right.
And his chemistry is way worse than my daughter's, who was on the spectrum, but now she is not. She outgrew her IEP at age 5. And now is mainstream. She gets a little bit of support in math, but I mean, it's minuscule. So it has implications not just for our kiddos, but also for, you know, parents to be looking at how we want to change the sort of epidemic of autism. We also have to look at the adults and the new generation of parents to be, and try and help them to optimize biochemistry so that our kids are brought into the world with a better shot.
Yeah, so well said. From your professional experience and from the science perspective, when you're talking about those epigenetics and the soup, as you put it, are there environmental things? Are there things like GMO foods or that are increasing? It seems like there's more autistic kids, right? Or we're more aware of it. And more depression, more anxiety. And again, that might just be we're more aware of it, but I think the numbers show it's increasing. Does the science show some of that's due to, you know, how we're creating our food and that sort of thing?
It does. I mean, so we all have, I sort of look at it as a rain bucket analogy, right? So everybody's brought into the world with a rain bucket, and some people's rain bucket is more full than the others. And so for some people, they're going to be more sensitive to pesticides in the foods. They're going to be more sensitive to heavy metals. They're going to be more sensitive to different illnesses and febrile illnesses and different chemicals. Other people seem like, or gluten or dairy or all of these things. Other people seem like they're fine and it doesn't really affect them, right? So epigenetically, we all come to the table with different vulnerabilities and different levels of sort of toxicity. And for some of our kiddos, they came into the world maybe with a bucket that was like 3/4 full, right? And so then we put anything on top of that and they're like overflowing. They can't handle anything. So it's not only, you know, decreasing the toxins and the drivers of inflammation, whether it be gluten, dairy, you know, food allergies or sensitivities can be, you know, a component. There can be different gut dysbiosis that can be environmental and or bacterial parasites, different pathogens that need to be treated. But it's not only decreasing the toxic load, but it's basically allowing the bucket to drain, right? So helping with detox, helping with them to be able to metabolize things better.
That's amazing.
Yeah.
Wow. So,
and then treating the parents before they become pregnant.
Yeah, I was going to say that's, or treat them as kids so it's all the way through, right? And get it from birth all the way through.
Yeah.
Wow. What advice do you have or folks that want to engage with you or any other functional medicine? I mean, what's the best way for them to engage and get the support they need, right, to really improve their lives?
Yeah, well, I would certainly have try and seek out a functional medicine provider within your area. Ideally, somebody who's Walsh Protocol certified, because that is just monumental for anybody who's having mood or behavioral cognitive symptoms. I mean, it's I can't impress upon you how much that has really changed my practice. I live in California, so certainly people can come see me. I'm currently getting licensed in like 42 different states. So I soon will be available almost, to anybody via telemedicine. So either reaching out to me. Currently, as it stands, I mean, the telemedicine laws are a little bit vague, but currently as it stands, if people wanted to see me, in theory, they should see me once in person, and then the rest can be done via telemedicine. Again, I'm trying to get licenses in over 40 states currently, so that I would be able to offer that to anybody.
Awesome. Well, we'll put links below so they can obviously engage with you, Cambria. You know, as we wrap up, any thoughts, anything we didn't cover you want to make sure our listeners hear?
If they are looking for somebody who is involved in functional medicine, I would just caution them to make sure that it's kind of the real deal. So there's a lot of people out there who are saying that they do functional medicine. And the gold standard for functional medicine is the Institute of Functional Medicine, which is the one who runs the Cleveland Clinic. Okay. So their training really is the gold standard, which is what I've been through. It's IFM, Institute of Functional Medicine, and they are extremely science-based. So everything that they put out there as a recommendation is backed by literally hundreds of thousands of studies. Nice. So it's not bogus stuff that, well, let's try this, let's try that. It's very, very evidence-based medicine, and it's legit. So they are currently doing a lot of studies on trying to prove to the world that functional medicine is indeed cost effective, because there is a little bit more money up front. Mm-hmm. In terms of, you know, my initial visit is an hour and a half, right? Mm-hmm. So when are you going to spend an hour and a half with your provider? Like never, right?
Never,
so
right? You're lucky to get 10 minutes.
My initial visit is an hour and a half, but
okay.
You know, I'll look at patients' labs and history over the past 10 years, you know, so you get a very, very thorough evaluation of what you're coming to the table with. And then honestly, I see my patients initially maybe once every 4 to 6 months. And then most of them, I'll see them once a year if I'm lucky, because they're better. So they don't need to come back and see me every 2 months.
Nice.
I'm setting them on a road to vitality and independence and, you know, self-sufficiency. So like my goal is to get you better, not to make you have to come back 100 times.
Right.
So, and the Cleveland Clinic is proving that that is a viable model, because yes, we're spending a little bit more money up front, but the amount that we save in diabetes care, heart disease care, cancer, you know, the end of life stuff is, or our kids who are very severe and they've got to be institutionalized, or, you know, they need severe medication. You know, I mean, the cost model is definitely viable, but it's more intervention up front and then setting you on a path for success.
That's amazing. And well, I mean, all those costs you brought up, Cambria, and also just living a more vibrant life. I mean, that's priceless, but I'm sure the folks that are under your care and under this type of care, the life choices, the ways they can contribute to society, it's really difficult to measure that, but inherently we know, right? Yeah. That's at a way different level than currently.
Yeah.
Awesome. Cambria, thank you so much for joining us. I'm so excited. I'm sure everyone listening is going to be rushing to find you, because having any kind of certainty, especially when you're dealing with Alzheimer's and autism and all these other things, is an amazing gift. So thank you for bringing that gift to the world, and thanks for being here.
Okay. Thanks so much.